Hello guys and welcome back, and today I'd like to talk about another marker which is commonly used in doctors' practices to determine your blood sugar or diabetic risk, and that is the HbA1c test, or A1C for short. Now this test, together with your fasting glucose, are the two most commonly used tests to determine your diabetic risk. But what I'm going to tell you today is how unreliable this test is based upon all the data which is being collated. So what is the A1C? Well, when you have glucose going around your blood at a certain high level, that can actually cause damage to the red blood cells and the hemoglobin. So when that damage occurs, it actually increases your diabetic risk. So we can have a higher blood glucose level, higher glycation level to the red blood cells, and that means a higher A1C. If you have a low blood sugar level, you have a low A1C test score. Now, what we do know is that when you have a higher blood sugar level, that actually shortens the life of a red blood cell. So typically a red blood cell survives in your blood for 120 days. When you have a high amount of blood sugar, it can shorten the life of that red blood cell to 81 days, as this study has shown. But if you have good blood sugar regulation, that red blood cell can survive to 146 days. So this huge variation can actually give both false negatives and false positives depending on who's being tested. So if you're diabetic, you can have an unusually lower HbA1c score, which could actually give you a false interpretation that you're actually healthy. Conversely, if you have someone who's very good on their blood sugar, they have a potentially slightly higher A1C because the red blood cell is surviving a little bit longer than normal and again being more glycated. So that can be a false positive. So we have to take the determination of how healthy someone is before looking at the A1C test. Also, this study showed that if you're anemic, you are also likely to have a false negative result of your A1C. When we go deeper in looking at the actual test markers and what determines risk, if you're 6.5%, that is determined as you're diabetic. Between 5.7 to 6.4%, you're determined as being pre-diabetic. But when we look at a study done in diabetes care in 2010, when we used a cutoff at 6%, what they found was they were misdiagnosing up to 70% of diabetic patients. And they were also misdiagnosing up to 94% of pre-diabetics. So these reference ranges are way out, and we need to bring them much, much lower. And when we go to a later study in 2015 in the Asia Pacific Journal of Clinical Nutrition, they actually looked at a particular group of Chinese. And what they found was the cutoff point for diabetes was 5.8, and for pre-diabetes it was 5.4. So you can see now, based upon some of these clinical studies, we've got to bring the reference range much, much lower. And I would say from a functional medicine perspective to bring it lower than 5.3. So this is really my recommendation to you guys. When you check your HbA1c, really reference it to 5.3. Now I will go into other tests and other videos to determine your true diabetic risk. But what I'd like to learn from you right now is what is your score? And what have you done to lower your HbA1c with lifestyle or supplements? Put your comments down below and we can start the discussion now. Bye for now.